All right, good morning and welcome to Coffee Talk. Today is May 28th, Thursday, and it's beautiful and sunny and about 80 degrees. So what wonderful weather we have had during this phase one reopening, and we're moving into our phase two. We have with us today Scott Gray, Chairman of the Jefferson County Board of Legislators and New York State Control Room member, and Steve Jennings, Health Planner for Jefferson County Public Health. And I've invited them back onto Coffee Talk today because it's been a really great opportunity to speak with them. They're at the front lines of the reopening of our economy, and I just want to publicly thank them for all of the hard work that they have done for our North Country region, Jefferson County specifically, and really setting us up for success moving through this phased plan that New York State has set forward for us. So thank you, Scott and Steve. And with that, I think we should just get started, and we will start out with a public health update from Steve Jennings.
Well, thank you very much. Good morning, Kylie. Thank you for all you're doing to link us to businesses quite efficiently so we can give them an update and work with them to get our economy rolling again in a way that protects the public. Just a quick update on numbers. As of yesterday, we had tested in Jefferson County 4,463 people through the pandemic. 71 of those tests were positive. All but one have recovered, and there are currently no hospitalizations. We had, as of yesterday, 96 individuals in precautionary quarantine, and almost all of those folks are awaiting test results. And we had 6 people in mandatory quarantine. Most of those folks have had some travel history, and we became aware of that, and they are in mandatory quarantine because they had traveled outside the United States. We are obviously following with an eagle eye our metrics that are required to be in place to reopen in the phases. The North Country region is doing quite well. We have met all the metrics. We continue to meet the metrics. And we're looking particularly at total numbers of people tested per day. We're looking at hospitalizations, and we're looking at deaths. And so in Jefferson County, we have not had anyone hospitalized since May 6th, and we have had 0 deaths, thank goodness, through this pandemic. And we are testing at quite a good clip. The region requires 419 folks be tested per day, and as of yesterday we were at 945 for the entire North Country region. I believe, and I have to get the clarity on the numbers, but we tested well over 100 yesterday in Jefferson County. We've been required to have in place contact tracers, and Jefferson County was required to have 35 contact tracers in place. And we have done that by utilizing public health staff, other county employees, and Fort Drum staff. And we've all been training through the Johns Hopkins University Contact Tracing Certification Program, which is a 5-hour training. And so many of our tracers got that done last week. And so we're really working hard to have that in place and to be ready to go should we need to call upon those folks. We did hear yesterday from the State Health Department that the CDC is no longer going to recommend antibody testing for decision making, which I don't think was so much the case in New York State, but perhaps in others. There's too many issues with the testing in terms of efficacy to be effective to reopen the economy. So we really are back to the nasal pharyngeal throat swabs as the best way to really know about disease incidence in our communities. We've been testing nursing home residents over the last 2 weeks, and employees. Employees will continue to be tested. We've had very little positive cases in those facilities. We had 2 employees test positive right out of the gate. They are now recovered. So things are going well, and we are working very hard to make sure the metrics stay on track so we can continue to support the reopening.
Thanks, Kylie. Thank you for having me, and thank you to Steve and all the staff at the Public Health. I will dovetail right in with what Steve was just saying. And if you go on forward.ny.gov, you will see all the metrics there that I've explained. If I'm redundant in doing this, it's because it's important to that everybody is fully aware of what's going on. So if you go down to the bottom of that page, forward.ny.gov, you'll see a yellow band and it'll say region by region status. And if you go to the right, there's the COVID tracker, which Steve was referencing, and that will tell you the number of tests, persons that we've tested in Jefferson County. It'll do it county by county statewide. Total positive test percentage. It'll tell you the total number of people tested the previous 24 hours, and if there's any new cases. If you go over to the regional dashboard, regional monitoring dashboard, there are all the metrics that Steve referenced. And just by way of a very brief explanation, if you look at them in a linear fashion, they're all logical. The first 3 basically track what we refer to as new cases or rate of transmission. The next 2, and this is kind of, typical disaster preparedness planning. The next 2 are preparedness, and that is the number of hospital beds and ICU beds, acute care beds and ICU beds available if we need them. And then the last 2 are mitigation items, and that is the testing and the contact tracing that Steve just eloquently explained to you. I will add that there's a lot of media on the testing of the nursing homes, and that is because that is our most vulnerable population. And I think Steve would agree to that if he's got anything contrary, but they're our most vulnerable population. And as we increase movement in the North Country and all across the regions, really our job is to make sure that we protect that population, and we continue to do so. And the reason that we're testing staff twice a week is because obviously they're moving around out and about in the public, and they're going to work every day. So in order to protect, we're kind of walling off, if you will, the nursing home residents from the exterior situation. And we do that by testing people. So that's why it's necessary in order to protect those people. So we've had to demonstrate the ability to test. That's what is really going to, if we see an uptick in the new cases, we're going to have to go back to that and really test out in the public. And that's when we'll deploy contact tracers if we need be. So with all that said, if you also go forward, you go up to the blue tab where it says New York Forward, and then there's a business resource tab. So phase 2 is a major opening because it restores a lot of office workers, administrative supports, professional services, retail is fully restored, and then real estate, rental, and leasing, and there'll be a few other things in there. So it is really regenerating all the office space that's out in the public, and so it's going to be a major opening, and so we got to do the best we can to manage it, and that's why we continue to ask you to take measures. When you proceed forward, you take the appropriate measures to protect yourself and protect others. Wear a face mask, and then wash your hands regularly. I will do a brief correction and clarification, more probably clarification because it's confusing. The article today's listed items that would be included. So there were several business sectors that were closed by an executive order previous to the governor's executive order on New York pause. Okay, so New York pause essentially in the executive orders that are all contained in there and put New York on pause and close the businesses and put us all at kind of a shelter-in-place status. That was an executive order that has been amended now for the regions that are opening phase one, and it's a natural progression in phase two. There were other businesses that were closed prior to New York on pause, and those will need to be opened by a distinct executive order, or the previous one amended or expired, or in some nature that has to be acted upon separately. Businesses include, but it's not a total list of them, but gyms, I believe, were closed ahead of New York pause. Restaurants were closed. Bars were closed ahead of New York on pause. Hair salons were closed, and a variety of other businesses. So those businesses have to be dealt with separately. And we anticipate hair salons to be opened with in some form or fashion right around phase two. But that will have to be a distinct executive order addressing that. I cannot, I think it's mentioned in the paper, maybe tattoo parlors and massage therapists. To be honest with you, I cannot tell you where they stand. I don't know if they're going to be included in phase two or simultaneously with phase two. So that may be a little misleading. So I just wanted to clear that up. That is a little confusing. So if you were an essential business, you're operating, and phase two is list one of the businesses that you're operating currently as an essential business for one reason or another. You have to go in and read and affirm the guidelines that are provided by ESD. We anticipated that site to be updated overnight. It is not yet updated. So phase two, the opening metrics should be, or the opening listings should be, and guidance should be there sometime today, I would suspect. So it's important that you go in, you read the guidance, you affirm to the guidance, because there's a listing, and the state keeps a listing of everybody, and we see it on a daily basis who's affirming that they have read the guidance. And then there's a template to download, and you have to imprint it, and then you have to fill it out, and you have to keep that on premises in the event that there's a complaint, or you have a positive case, or something of that nature goes astray, and somebody, either codes or the public health department, has to come into a business. They're going to want to see that your template. So there's no need to file it with us. There's no need to file it with the county. There's no need to file it with the state. It's just something that you keep on hand. And it is the right thing to do for both your staff, and if you have a public access, it's the right thing to do for public access as well. So we ask you to participate in that and do your part. You know, I know businesses are getting anxious, would be probably a good word to put it. And we are really in the control room. We monitor the metrics. We talk over some of the issues that we have in terms of compliance issues and things like that. And frankly, we advocate on your behalf. If we feel that there is a business sector that is consistent through the region, that is important to us, that should be moved up in some form or fashion and has a reasonable way of doing it, we will advocate on your behalf to do that. I know for one, you know, tourism has been a big issue for us, and we're trying to get as much of the tourism industry going because they have a very short window to operate in. And along with that, we have been advocating for some outdoor dining in terms of restaurants. Whether that will happen, it's yet to be seen, but we continue to advocate on your behalf. if there is something that is consistent through the whole region and everybody can get on board with that, then we certainly advocate for that as region-wide, because it's not going to happen on a county-by-county basis. So that's pretty much where we're at today. We are, like I said, we're open tomorrow morning for phase 2. Hopefully it is important that, that you follow the guidelines and that we're able to minimize any, hold on, my phone is just blowing right up. So it is important that we, minimize, it's a control room member, I'll let them listen in. So it's important that we minimize any risk that we have for people out there, and that we continue to move forward, and we successfully go through phase 2 so we can get on to phase 3 and phase 4. So that's what I kind of tell everybody. You have both a responsibility and respect. You should act with responsibility and act with respect. Responsibility is you have a responsibility to your staff, okay, to make sure that they're safe. Employees and staff should be kept safe, and that's your responsibility if you own a business or you manage people, or you're some sort of in management. That is your responsibility to those folks, is make sure that they are comfortable coming to work and they have a good, safe environment to work in. And my friend who is calling on my cell phone, Mr. O'Driscoll, you probably know, Ron McDougall calling in. So he will concur with that. It's all about employee safety. So, but if you have public access to your facility, you want the same measures put in place. You want the public to be able to come in and use your facilities with a sense of confidence, and you want them to be at ease. So, and you want to make sure that they're protected. So what we don't want is to trace, if there's a positive and it's related to your business, we do not want to have to trace it back to your business. And unfortunately that could happen. And we could, have to quarantine a large portion, if not your entire staff. And so you'll be shut down. So that's your responsibility to the public and to the, your workforce. Respect. I will tell you one more time, I keep repeating myself, but it's important. You have respect to phase 3 and phase 4, those businesses that are waiting to open, and they should do so in an appropriate manner. We promised people that we would deliver on time openings, and that is 14 days. There's a reason behind 14 days. It's the ultimate incubation period. Is that correct, Steve? It's the incubation period for the virus, the max time. So if we're going to see any uptick, we'll see it within the time of the opening to the closing. Now, there's some nuance to that. So, Memorial Day, there was a lot of activity around, and that was in the middle of the 14-day period. So, potentially we could see that uptick in the middle of the phase 2 opening, and that could be a result of whatever events took place on Memorial Day. So we just ask you to still be vigilant and do what's responsible. Large gatherings are still prohibited. That is a separate executive order. They are limited to 10 people, fewer than 10 people. So we get calls, numerous calls. I got the call over the weekend, all weekend long, about large gatherings, and it's not the right thing to do. So I would ask you to please bear with us and give us some time here. Give yourself some time, give the public some time. I think that pretty much clears up everything. And if you have any questions, I'll be glad to take them. Steve or I will.
All right, well, great. Thanks so much, Scott. And there are some questions coming in. I just have a quick question. Are we on track, I suppose, or are we following a similar timeline for phases 3 and 4? I know Governor Cuomo mentioned at one point, right now it's not totally clear what the phase 4 timeline will look like. Do do you have any insight for that?
No, we're planning on every 14-day period. So hold on, I'm going to try to take these off. And I'm going to see. Can you still hear me?
Yep.
Okay, perfect. So I have another member of the control room on my phone. Mr. McDougall, do you want to say hi?
Well, good morning. Who am I talking to?
The Chamber of Commerce Coffee Talk. He's a special guest. He's a member of the control room. So he just called into my phone. So we gotta ditch this other call that's coming in. There you go. So yeah, we are scheduled every 14 days, and we don't plan on any deviation unless, in fact, we see our numbers go up.
Okay, great. Thank you. Good morning, Mr. McDougall. Thanks for joining us. Great addition.
That was Kylie. That was Kylie Peck.
So we have questions coming in.
10 o'clock call is postponed today, Scott, on our subcommittee, so you got time to do this. Right?
That's right. That's right. So you pay attention here. Okay, yeah, we got questions.
Fantastic. So we've got quite a few questions coming in. This one's probably more for Steve. Are we seeing an uptick in mental health and drug abuse issues in the area? And are there any updates you can provide on that? That might be a whole nother coffee talk option, actually.
Yeah, so I can tell you what I know, and then Chairman Gray, I believe there was a presentation to the board this week from Tim Ritten that you might have more information on. I wasn't at that meeting, but we are seeing an update in overdose activity. We are following in real time what's happening out on the streets, because we have many first responders telling us. We have a system called OD Map where they can report in and tell us what's happening. We've had 11 confirmed overdose deaths this year, with another 4 pending. That's very high. I mean, if we keep going on that track, we're going to be at 33 deaths this year, which would be our highest ever since I've been here. And the predominant drug is fentanyl. I mean, it's about 73-75% of the deaths mixed with heroin. So we are concerned about it. I happen to chair our Drug-Free Communities Alliance for the county, and we are talking about what to do about it. Some of our preliminary discussions have been on, people have more money these days. People who are addicted to drugs may have gotten stimulus payments. In fact, we've heard some of them have as we investigate cases, or they're getting enhanced unemployment and they have more money to spend on drugs. We've heard drugs out on the street are cheaper. There's a lot more dealing going on. So we're very concerned about it. Our alliance is going to have a special meeting about it to talk fully to see if there's anything we can do. And then my sense is Tim probably reported to the Board of Legislators greater mental health access to services, but I don't know if Chairman Gray could comment. I don't know if you were at the meeting.
I was at the meeting, and I've scheduled we have a behavioral health meeting of all the providers. Scheduled that for, I think it's next week. I don't know if Steve will be on, but that would be a good topic, Kylie. I would volunteer Tim and Steve to do hand in hand for a coffee talk. It is a major concern. Steve is right. Money is the root of all evils in this regard, and it is playing into effect. And all you have to do is watch the drug that they're using, because if they're on the cheap, they're using meth. And when it switches over and people have money in their pocket, money to burn, it changes over to more expensive, so to speak, more expensive street drugs. And it's a major issue. It's a major concern. Our agencies are ramped up as much as they can be. They're doing a lot of everything through telecommunication. But I took somebody over to Credo yesterday, so for assistance. So it's a concern out there, and it's one that's near and dear to me. So, yep.
Sure. Thank you for that. And we'll be in touch about potentially scheduling that as a separate coffee talk. I think that's a really important topic that we all need to stay updated on as we move through this. Moving more into some business specific questions. Should businesses recommend their employees get tested before returning to work? And is that even something that you're able to do?
Steve, you want to take that?
Sure. So we know the success to reopening will be testing because that's the only tool we have at them. There's no treatment, there's no vaccine. The issue is there's not enough supply to do all the testing. And I believe the governor has said everybody can get a test, or every essential worker. And the president says everybody can get a test. The fact of the matter is there's not enough supply. And so we've been funneling every added resource we get here into the nursing homes. As Chairman Gray noted, they're the most vulnerable population. And we need to keep testing the workers there and the residents as the state tells us they need to be tested. But over time, it's getting better. It's not fast enough. But I believe that testing will be expanded to a point where everybody could have a test. And I think we're going to have to do it without any other tool, and I think we're going to have to keep doing it going forward. So we're obviously on many state health department calls and in tune to what's happening. Every area of the state is having the same difficulty we're having in terms of supply at the moment.
But as a rule, no. And there's certain protocol of testing, and that's we've cleared up some of the language that the governor has used. We've asked them to clear up some of that language because he keeps saying get tested, get tested. It's not that easy. You have to meet certain criteria to get tested. And if you don't meet that criteria, you just can't walk in and say, I want to be tested. So.
Okay, thanks. Scott, do you know if there's been any updated information about the opening of dental offices, both private and those within our community health center?
Dental services should be phase 2. There'll be guidance for that. So they're professional services. We anticipate them being open in phase 2. So you'll see specific guidance for it. Right now, they're essential in terms of emergent care. But, regular dentistry will be available phase 2. So schedule your haircuts too.
Okay, great. With administrative offices opening, is remote work expected under the guidelines to continue if possible?
Not to my knowledge.
No.
Okay. I believe they're going to be opened up, and that will be probably an individual business choice. I don't know what the parameters are. So when you do open, when the guidelines are all updated, you'll see a view of summary guidelines, and then it says read and affirm detailed guidelines. And in those detailed guidelines, then they'll all be broken down by business sector. So there's a lot of work that goes into this. And what is it? Not opening. There we go. There's a lot of work that goes into these sites, into this, but there's very clearly laid out guidelines that you have to follow on a business by business sector. And there's mandatory practices that you're going to be asked to do, and there's going to be recommended best practices. So you'll see those on whatever your business is. So.
Yeah, I've talked with quite a few businesses in the area that are opting to continue to work from home just because they feel it's safest for their staff and their customers. And, they've found it to be beneficial, especially with some childcare facilities not open and school not being in session. So they're going to continue to work from home.
That's an individual business if they can, and if they want to. That's certainly not discouraged.
Absolutely. You mentioned earlier the executive order on gatherings. But is there anything that you've heard that will, any guidance on when we'll be allowed to have more than 10 people?
There's no guidance on that. No, we just opened, that was opened up by the governor earlier this week. But there's been no guidance on that. If you want my editorializing here, I would say probably once we get past phase 2, you'll see some more latitude. You're starting to see a little bit of latitude right now. We opened up the tour boat lines yesterday, so you're starting to see a little bit of latitude. I think you'll see that continue probably through phase 2 as we approach phase 3.
Okay, great. Is there a list that we can find businesses that were closed before the New York on pause?
Oh, a list of businesses. There's a list of essential businesses. That, yeah, under ESD, there was a list of essential businesses, and I think so. Anything outside of the essential businesses that were closed. So I don't think there's specifically a list of businesses unless they were singled out in an executive order, such as hair salons and bars and stuff. But I think it was a list of essential. That's it.
Okay, great. Okay, here we go. There's lots of questions coming in here.
Okay.
It's my understanding that essential businesses that never had to close do not have to do the affirmation, but they do the safety plan. Is that correct?
That is not correct. They have to affirm. They have to do the affirmation. Once the phase catches up with you, that so if you're operating an essential business, whatever the nature of it is, once that phase catches up with you, you're opening in that phase, then you have to do your affirmation at that point, because up until then, there's no guidelines for you. So you have to read and affirm the detailed guidelines. And so, and that is regardless of your opening up new, or if you were essential and previously operating. So you have to do that.
Okay, I think that particular one might be lodging. So that guidance hasn't come out yet, but once that is released, you will be required to go in and do that affirmation for that.
Correct.
All right. With the recent findings on aerosolization, that's a harder word for me to say than normal, of the virus, do you anticipate the safety plan companies need to develop and enforce are going to have additional requirements related to ventilation of indoor spaces, in addition to cleaning, masks, employee health checks, etc.?
That is a very good question, and would be a to be determined. I know for a fact colleges are having to go through an extensive work on their HVAC systems, so before they reopen. So whether businesses are going to have to do that, that's a good question. I don't know the answer to that right yet, but I can follow up. If somebody wants to email me, we'll get an answer to it. We'll put it forward to the control room call, and within probably, if they have any insight, they will share it with us within 48 hours, or it will be addressed at some point. Is that correct, Mr. McDougall? Did I lose him? He's there.
Oh no, I learned how to mute.
Okay. He forgot one day he was not muted on a call, so.
Yeah. Once upon a time that did happen a couple weeks ago.
Okay. All right.
I guess it was okay. At least Senator Ritchie said it was okay because I was talking about her. So
okay. Question. Next one.
All right. Is there any discussion about liability for businesses or organizations who do host an event, and if there's an extreme case, someone contracts COVID and either dies themselves or passes it on to someone else who ultimately passes away?
That's a legal question, and I would suggest that you talk to your lawyer about that. You get an appropriate answer from an attorney, not from me. No, I would tell you though that if you're not in a phase that's opened and you try to open, you do run a risk. There are several risks that are associated with that, especially if you're permitted to operate by some sort of licensing, certification, or permitting process, whether it be, State Liquor Authority, Department of Health, Ag and Markets, any other agencies that operate by permit process or certification process or licensing. You run the risk of putting those in jeopardy if you open ahead of time.
All right. Business liability is obviously a big concern. What measures should we take to limit our liability exposure in regards to employees back in the office and out in the field?
Well, I think if you follow your guidelines, I think you're going to limit your, you're going to limit your exposure that way. That's the best we can tell you at this point. Follow the safety template and monitor your employees if they're in and out. You have to check their temperature in and out of the building. It's not required that you keep a log. And as a matter of fact, it's suggested you do not keep a log of that. But you should check people in and out of your establishment and, monitor their activities and, follow your safety template to mitigate your risk.
Right.
What phase do you anticipate private fitness studios being included in?
Private business studios.
Nope. Fitness.
Oh, fitness studios. Yeah. Oh, phase 4.
Phase 4. Okay.
Yep. Yeah. So phase 4 is recreation, and a lot of that is intentionally is indoor recreation. Now gyms again were I think they were closed by separate executive orders, so they'll be addressed distinctly by an executive order. But a lot of the indoor recreation is based. We are advocating a little bit for some outdoor activities. We did golf, and we're starting to advance a little bit. Little League for some kids to get out and start playing or at least practicing. So.
All right, great. What phase do you anticipate pools being able to open since they contain chlorine, which kills viruses? And is CDC guidance out there on aquatic openings and social distancing? Obviously, beaches are open. Do you have any guidance on that?
I don't. It's interesting because they've opened municipal pools now. So I would expect that we can make the case that if they're going to open up municipal pools, that they should be able to open up other pools, but that has yet to be determined. But anytime that we have, what we try to do is address some of what we perceive or what the public perceives to be inconsistencies. That's a lot what we do in the control room, or what I do. So. And so we try to rectify, we try to resolve those inconsistencies as much as possible. Nobody said this would be easy. Shutting down was easy. Opening up has not been anything but easy. Yep.
Scott, can you tell me, or tell the group, I guess, if someone has a reopening idea on something like maybe pools, would it make sense to contact you to bring that to the control room to talk about on a larger scale?
Yes, and if you have something in writing, you can email it to me, and I will certainly advance it by email to the control room members. I do that frequently. Okay. Mr. McDougall will attest to that.
Great. Has this?
There you go.
Has the state expanded upon the attractive nuisances, precaution to the control room, since so many businesses and activities could be described that way, but have not been assigned a phase, such as the boat tours that were allowed to operate as of yesterday?
Repeat that again. So first of all, I got hung up on the phrase attractive nuisances. Okay. So, and we have politely asked that phrase be retracted. because that is in the sense it probably, and again, I'm going to go outside my MO here and operate where I'm not supposed to be, but it's a legal term. So in the sense of the term, it's a legal term, and it really shouldn't be attached to this. And so we've asked for that phrase to be kind of retracted. So because the other thing, it concerns people because it has the implication of liability. So so anyhow, repeat that question. Without that phrase in it.
Has the state expanded upon the precautions to the control room, since so many businesses and activities could be described that way, and have not been assigned a phase such as the boat tours?
Yeah, well, we continue to advocate for more of that to be opened in a legitimate way. Boat tours can kind of, we mentioned that a long time ago. I mentioned that a couple of weeks ago. That came out of nowhere yesterday. We did not expect that, but they're cognizant of the region, and so we look at several of those things, several of those functions. Things like Old McDonald's Farm. We're advocating to try to get that open as quickly as possible. Some certain attractions like that we believe people can manage and monitor the situations like that. Some of those things are important to, everybody knows the Syracuse Zoo opened, that was opened out of compliance. So there's a lot of areas that press forward, and we have tried to stay within the guardrails here and do what is right. But, certainly we advocate for those additional attractions.
Sure. Can you tell us how we would locate business affirmation forms for healthcare facilities that never closed?
Oh boy, that's a good question. I do. What are you going to say?
Well, aren't those documents available through Forward?
The healthcare?
Yeah.
I haven't seen healthcare.
If not there, then through the state health department. I mean, I'm surprised
I would think
communicated with directly.
Yeah, I lost you, Stephen. I don't know where you went to, but I wasn't sure if you were still on. So yeah, that's a good one. Steve. Probably DOH.
Yeah.
If you're a healthcare facility.
If you're a licensed healthcare facility, I'm surprised you haven't been communicated with directly.
Mm-hmm.
And I'm not sure. I don't know.
Why don't we broach that this afternoon at 2:00?
Okay, we'll do that. There's another member of the control room. Going to take that up the chain with me.
Great.
I don't know if the questioner is a licensed healthcare facility, but we're communicated with multiple times a day. So.
Okay, great. If there's no other questions, Scott and Steve, do you have any parting words of wisdom as we move into phase 2 and reopening the economy?
Steve?
I have a question. Scott asks us to send him an email. What is his email address?
So it's Scott G at co.jefferson.ny.us.
Thanks, Scott. I did include that in the chat for everybody. So if there's people that have called in, I apologize. I included that in the chat so everybody can see that as well.
Steve, you have any closing comments?
So I would just say thank you, and that if people have questions, please contact us. You can call me at 315-786-3710. And if we don't know the answer, we can try to get you to the right people. We aren't allowed to approve anyone's plan, but people certainly have questions. And, you really have to demonstrate that you're protecting your workers and your customers. And there's a lot of good guidance out there on how to do that. And we can steer you toward that.
Correct. I am going to defer my closing comments, if you don't mind, Kylie, to another member of the control room, Mr. McDougall. Do you want to add anything before we go?
No, but we get educated every day. That's all I've got to say, really. And as far as at least for the part that I was in on, you answered everything correctly. If you didn't know, we're going to refer it, particularly with the health question or health agency question.
Yep. If you have any questions or concerns, like I said, if it is something that we can build a coalition of support for region-wide, I think Mr. McDougall will confirm that we certainly advance it to the state level on your behalf. That's what we do. That's what we're here for. We're really here to monitor the metrics again and make sure that there's a level of compliance so the public is protected and we don't have to pause the situation. We get through phases 2, 3, and 4, and hopefully we don't ever have to revisit going back to this lockdown, or not lockdown, that's a bad word, this shelter in place that we had, because we do have all the metrics to monitor the situation going forward, and we have the preparedness and we have the mitigation efforts with the testing and the tracing to mitigate any situations should they arise. So therefore, we should be able to function, coexist with this virus going forward until there's some sort of vaccination or treatment for it. So with that, again, my hat's off to all the healthcare workers. You have done yeoman's work to try to get us to where we are today. And, to everybody that's been working as part of Essential, and to those that are going back to work, good luck, and be safe.
Great. Thanks so much, Scott and Steve, for joining us this morning, and for everyone else that was able to join the call today. We recorded this, so we'll share it for those that maybe had questions that didn't get to join, and they can listen back. Thank you. As we move into phase 2, let's make sure we're diligent in continuing to adhere to the guidelines, social distancing, wearing masks. Very quickly, I just want to throw out there that we did start the Watertown Farm and Craft Market yesterday, Wednesday, May 27th, and I'm very proud of the community for taking the guidance seriously and showing their respect for one another, for our community, and for our economy as we continue to open up. 90% of the guests were wearing masks and were very respectful as they were managing and shopping at the market. So I think it's great if we can continue down that path. I think we'll be set up for phases 3 and 4 in a timely fashion. So thank you everyone for joining us today. I hope you enjoy the rest of your week.